millions of people, going to the doctor doesn't just mean dealing with health. It also means going home with a huge bill that takes long to pay off. 3 out of the 10 working adults were paying off medical debt. This matters to all of us because we never know when one might need to get an emergency treatment. Even with insurance, there can still be a lot of medical debt. I learned more about why medical debt is so common. I researched information from organizations like the Commonwealth Fund, the Consumer Financial Bureau, and the KFF and other reliable sources. The main problem of medical debt caused by high healthcare costs can be solved by expanding more affordable healthcare. First, we need to look at just how serious medical debt can get. Medical debt is a major problem because it affects people's finances and can even keep them from getting the health care they need. In its 2024 survey, the Commonwealth Fund found that 3 out of the 10 working age adults were paying off medical debt. That's a lot of people dealing with debt because they needed medical care. This shows that medical debt isn't rare. The Commonwealth Fund's researchers Sarah Collins and Avni Gupta found that more than 1/3 of people with medical debt delayed or avoided healthcare or medications because of that debt. So medical debt can create a cycle where people can't afford their bills. The Consumer Financial Protection Bureau reported that 15 million Americans have medical bills on their credit reports, totaling more than $49 billion. Medicaid debt can follow people long after their treatment is over, and can hurt their overall financial situation. So if medical debt is this widespread, we need to look at one of the main reasons people end up with it in the first place. One major cause of medical debt is that many people either don't have affordable insurance or have insurance that still leaves people with high bills. Sarah Collins and Avni Gupta of the Commonwealth Fund found that nearly 1 in 4 working age adults were underinsured even though they had insurance all year. This shows that simply having insurance isn't enough. If the deductible and other costs are too high, people can still end up getting medical debt. The KFF reported that in July of 2026, that about 1.2 million adults remain in the Medicaid coverage gap because their state has not expanded Medicaid. These people make too much to qualify for Medicaid and make too little to qualify for marketplace subsidies. Economists Kenneth Brevoort and Daniel Grodzicki and Martin Hackman found that Medicaid expansion reduced unpaid medical bills sent to collections by $3.4 billion in its first 2 years. This is important because it directly connects affordable insurance to less medical debt. If affordable insurance can reduce medical debt, then the solution should focus on making coverage available to more people. Congress should pass a law requiring nationwide adoption of the Affordable Care Act's Medicaid expansion for eligible adults. Economist Luohia Hu and her co-authors found people who gained Medicaid coverage through expansion had $1,140 less in collection balances. This shows expanding Medicaid can also protect their overall financial health. The KFF's 2026 Medicaid tracking shows 41 states and Washington, D.C. have adapted to the ACA Medicaid expansion. So this isn't a new idea. It's working across the country. The congressional budget office explains that federal government covers 90% of the Medicaid expansion service costs. Expanding coverage would cost money, but research shows it can prevent billions of dollars in unpaid medical bills. Medical debt is a serious problem, and Medicaid expansion has already shown it can reduce that debt. Medical debt affects millions of Americans, hurting both finances and health because of non-affordable insurance. Congress can also solve this problem by making ACA Medicaid expansion available nationwide. At the beginning, I mentioned how a doctor or hospital trip can leave someone paying off a bill for years. Contact their U.S. representative and your 2 U.S. senators through their official congressional websites, by phone or local offices. Ask them to support legislation that would expand ACA Medicaid coverage nationwide to adults up to 138% of the federal poverty level. Getting sick should be a health problem, not a financial disaster.